Welcome back to the show, everyone. I'm here with Dr. Andy Barlow and one of his patients, Roger. Of course, they're all from Regenerative Medicine of Mississippi, and we're talking about stem cell therapy and the success stories that Dr. Barlow is having. Welcome back to the show, my friend.
Thank you, Troy.
Roger, thank you for coming in. I really appreciate it. I am loving this conversation and hearing how you're helping the population of Mississippi be pain-free.
Yes.
How is that possible?
Well, it's the miracle of stem cell therapy.
What is it?
And it's the ability of the body not just to get out of pain or to decrease pain, but actually to regenerate and restore and rejuvenate damaged and injured tissue.
How is that happening? Now, you and I have had the conversation before. That was a whole conversation, but let's dumb that down very quickly for the viewers. What is stem cell, and how are you fixing the pain?
Okay.
With what?
Well, what we use, our regenerative medicine that we use, is what is called mesenchymal cells. And it's a tough word to say for most people, but basically there's a cell inside of the umbilical cord that actually has the ability to regenerate and rejuvenate damaged and unhealthy tissue.
And that's injected into that pain area?
Correct.
Into the bone or into the muscle?
Into the joint, actually.
Okay, the joint. Okay, all right. Roger, this is where you step in. You ready for me to grill you?
Go ahead, I'm ready.
How much pain were you in on a level between 1 and 10?
At least an 8.
On a daily basis?
Yes.
Were you on pain relief medication?
No, I don't like to do much of
You were
that.
putting up with it?
Yes, I don't like to cover the pain.
Okay, you were just living through it?
Yes.
Okay. All right, where was the pain and how did it all start?
I had a stroke 4 years ago.
Yes.
It was a different type of therapy, but the pain only started about 3 or 4 months ago.
Okay.
Back of my neck and my right shoulder.
Right.
And go ahead.
And you were saying that your lower back joints as well?
Yes, my lower back as well. It wasn't hurting constantly, only when I stood still for about 5 minutes at a time.
Okay, explain when you say pain, you know, I've got pain in my elbow right now because I'm leaning on it.
Yeah.
What type of pain did you have?
This type of pain is, if I stood more than 5 minutes, I had to sit down because I couldn't stand it.
Really? Was it piercing? What was it, throbbing?
More of a piercing.
Really? That's the worst. When it's a sharp knife type of feeling, correct?
That's exactly right.
All right.
Exactly
How many
right.
injections have you had?
1 set.
1 set. And how soon after that did you?
3 to 4 weeks.
Okay, well, it's interesting you say that because some of the people we've had on with their success stories, Dr. Barlow, you can answer this, there's a variation with instant pain relief, or why is that?
Yep. Well, now we've got to use another fancy word that most people have never heard of. It's called cytokines. And that's another bit of magic that's in the mesenchymal cells. And cytokines, what they do is they actually have the ability to suppress pain. And so the pain suppression, of course, we want patients to feel better, but more importantly, we want them to feel better and regenerate the tissues over time. And it's according to what level of degeneration that they have as to how long that it may take for them to start seeing relief.
Okay, interesting you say that. A question just popped into my head. After Roger finishes his treatment, does he need to come back, say, in 5 years?
Typically not. I mean, I tell people this all the time. You know, life does get in the way, and that means that, you know, people may have a car crash and their knees hit the dashboard.
Yes.
They may fall off a ladder painting their house or something. But typically, you shouldn't.
Pain, how's it changed your life not having the pain?
It's just wonderful. I mean, I've been through different types of pain before, but that was the worst. And having the relief on it makes a big difference in my day-to-day quality of living.
All right, thank you so much for both joining us. We really appreciate it. If you want to find out more information, there it all is up on the screen, everyone. Dr. Andy Barlow from Regenerative Medicine of Mississippi is there to make your life pain-free. That's right. You're watching On The Beat, everyone. Back after this short break.